everybody, and welcome to today's video. Today I'm going to be ranking my third year rotations from worst to best and letting you know at the end what residency I am pursuing after medical school. I also have a giveaway at the end of the video, so please be sure to stay tuned till the end. Now, if you guys don't know me, I'm America. This is my cat Calyx. I am from Houston, Texas. My dad is a veterinarian, and I have had exposure to the medical field ever since I was a little girl. I was attacked by a pit bull when I was 4 years old, and so I have this totally subconscious, unwanted fear of large dogs, so I couldn't follow my father's footsteps to become a vet. But growing up, science was my favorite subject in the whole wide world. And so being around the medical field, growing up loving science, I decided I needed to pursue a career in the medical field. When deciding between wanting to be a nurse practitioner, a PA, or a doctor, I decided to go for being a doctor, a physician, the most educated and the longest training out of all of them, because I'm not one who likes to listen to other people tell me what to do, and it scared me the most. And so I thought that if it scares me the most, it excites me the most, it's the hardest to get into, but I could do it if I wanted to, and it's the one where I get to be the one in charge. I get to be the one that people answer to. That's what I want to choose. And so I went with becoming a physician. I went through 3 years of medical school, and through that time I was able to talk to a lot of different physicians and different specialties of medicine. And I went through my third year rotation, which consisted of 8 different rotations. And at the end, I was able to pick one of them that I loved the most, and the one that I'm going to dedicate the rest of my life to, training to be and being the best of. In third year, I went through these rotations in this order: family medicine, pediatrics, OB, psychiatry, internal medicine, surgery, neurology, and emergency medicine. This is the order of which I'm ranking them in from worst to best. Now, obviously, very importantly, I have to make a disclaimer, because any video in which you portray your opinion is obviously going to be received a million ways. There are lots of people in this world, and we need all sorts of doctors in this world. I'm so happy there's pediatricians, surgeons, family doctors. I'm so happy that people ended up wanting to do that. And I am totally okay with the fact that people will absolutely have hated the residency I'm choosing. But just because I chose this doesn't mean that it's the right one for everybody, and I don't expect anybody or everybody to like it. So just to say again, this is my opinion. I'm only going to apologize for my opinion once and not have to repeat myself throughout the rest of this video. So let's talk about my not so favorite rotation in third year. Now, I'm going to cheat a little bit because these two rotations kind of go hand in hand: internal medicine and neurology. Now, neurology is pretty much just internal medicine, but exclusively for the brain, so I'm just going to lump them together. Now, this is very interesting because actually most people in medical school tend to pick internal medicine. It is one of the most popular, if not the most popular, residency for people to go into. But I'll tell you why I didn't want to go into it. I'm someone who really loves anatomy, really loves to use my hands, and I found that internal medicine and neurology are mostly about brain power, in which you think about all the different differentials in your head, give medicines, diagnostic tests, anything that you can to figure out the end differential. Internal medicine takes care of patients who are just all over the board. They could have COPD, jaundice, seizures. You have to know so much. A lot of being an internal medicine doctor is being in the office with your team, discussing the differential, the plan for all of your patients, seeing your patients for 30 minutes to an hour every day, going back to the office, writing notes, answering calls, talking with attendings. I personally wish there was a little bit less time on the computer writing notes, making those phone calls, but obviously that's something that somebody has to do. Somebody has to bring everybody from the hospital together so that we can fix the patient. And obviously it's a fantastic job, but it's just not what I'm looking for. So in summary, a few of the things that made me hesitant about pursuing a career in internal medicine are the long hours that we have to spend in an office. And out of all of the residencies, internal medicine is up there in amount of hours that you spend in a hospital. And that's fine, but the amount of hours that you spend is a lot in your office. The wide amount of knowledge that you need to do your job, and the small amount of patient interaction that you do. Also, there's very few procedures that you need to do throughout every day compared to some other residencies. All right. Up for the next one. The next residency that obviously was amazing, but just didn't fit my personality as well as the other ones, is obstetrics and gynecology. Now, this came as a huge shock to me because I went to medical school to become an OBGYN. Having this be towards the bottom of my list was a little bit shocking throughout my third year. One really important tip that I will give you when you're a third year medical student is that a lot of how you see a residency is strongly dictated by the people in that residency. There are just some personalities, for whatever reason, that gravitate towards different fields of medicine that fit yours a little bit better than others. I did not have the best OB-GYN rotation. I feel like I didn't enjoy my OB-GYN rotation for that reason mainly. As a third year medical student, you are the bottom of the totem pole. You know the least about everything, and you are just really a hazard sometimes. Some people are a little bit more empathetic and understanding of that fact, and other people are not. But aside from all of that, OB-GYN is really focused on the reproductive system, the uterus, the vagina, and the ovaries. And I found that I wasn't very passionate about that organ system as much as I thought it would be. I love interacting with women. When I volunteer, I love to volunteer at women's shelters for whatever reason, but I found that I didn't really feel passionate about the subject material. So ultimately, it was a difference in personality and a lack of passion for that particular organ system that made me think that obstetrics and gynecology was not the residency for me. I will say though, one of the most magical moments I've had in my entire third year was helping a woman hear her baby's heartbeat for the first time. I think I automatically smiled and almost cried when I helped her hear that, and I will always remember that memory. And this is just another reminder to everybody that even though you enter medical school knowing that this is something you want to do, you could totally surprise yourself in the end with what you end up with. Next on the list is pediatrics. Now, I loved my pediatrics rotation. I will always love children. I love hanging out with them. I love being with them. I think that they love me back. And I am always and will always be jealous of the people who get to hang around children. Now, the reason I'm not choosing pediatrics as my future career is because I feel like pediatricians have a large volume of patients to see. And when I was on my rotation, I was literally, I felt like I was running through all of these patients' rooms, trying to see a patient in 15 minutes, put out some note, see another patient in 15 minutes. There are just so many patients that you have to see. And I haven't seen that amount of volume in patients in almost any other rotation. Because children aren't just adults who come in when they're sick. Children come in when they're sick, but they also come in when they need vaccines, their asthma medications, and their well child visits. So you need to see them more, and there's so many children. And not only that, but you also have to kind of handle the parents as well. Parents have a lot of concerns, especially when they have a newborn baby. Parents sometimes show up late, and you want to be mad, but you can't because you have to take care of the child. And so I feel like pediatricians deal with late appointments a lot. And parents bestow their own morals, ethics on their child without really sometimes thinking about the child's health. And so there's a lot of weird moments between parents and pediatricians when parents decide that they don't want to get antibiotics for their child's possible meningitis, or they don't want to give their child blood, or they don't want to give their child vaccines. And there's just a lot of that you have to deal with. Also, I'm not afraid of blood, I'm not afraid of knives, cutting. Body and anatomy physiology is my thing, but I have a little bit of a weak stomach to mucus, and children tend to have a lot of mucus. And so whenever I ask them to open their mouth and there's a huge amount of mucus in their mouth, I find that hard to deal with. And so I loved my pediatric rotation, but for those reasons I wasn't going to pursue it. Next on the list is actually kind of a tie between family medicine and emergency medicine. Now, I love them both because there's a lot of time that you get to spend with patients, lots of different diseases that you get to see, and a lot of procedures. Now, I'm a big procedure person, and family docs and ER docs get to do a lot of them. They're also the first two people to see a patient, and so if you want to diagnose somebody, you're probably going to do it before anybody else. So I feel like their work is very meaningful because they're the ones that are usually like, that's it, here's what I can do to help you, here's some other people that can help you. Now, my emergency medicine rotation was a little bit stressful because it requires having a lot of confidence, and it requires a lot of sureness in your ability. Because when a patient is coming in and their heart is stopped and you need to get resuscitation going fast, I feel like I'm the type of person who would get really nervous and scared in that situation. Whereas that kind of adrenaline drives some people. Some people thrive on the adrenaline of an emergency, whereas for me, it kind of makes me a little bit uncomfortable, nervous, and my heart's racing, and I feel like I'm not gonna do a great job in emergency situations. Now, family medicine was amazing because in one room, you got to help a patient with psych issues. In another room, you got to remove warts. In another room, you looked at somebody's eye. In another room, you were doing a well child visit for a child. And as a family medicine doctor, you can deliver children. They can do so much. And they have great hours, about 9 to 5, Monday through Wednesday, hardly any call. Now, I'm just saying this, if my first choice does not work out, I will probably pursue a career in family medicine because I loved it so much. But here are the few reasons why I was a little hesitant about family medicine. Similarly to pediatrics, family doctors have to see a lot of patients. And so although I didn't feel like I was running through patients like I did in pediatrics, I did feel like I was taking a brisk walk through all of the work I had to do. And so although you only work from 9 to 5, you sometimes have to stay after to finish your notes that you weren't able to do because there were so many patients back to back. Family medicine also has to deal with a lot of paperwork, such as they'll bring documents for disability, for work, or for their emotional support animals, as well as refills and a lot of insurance issues. Now, if I were a family practitioner, I would love to have my own business because I love to be the one in charge. But as a lot of you know, it's becoming a little bit more difficult to have your own practice as a family practitioner because dealing with insurance is so difficult and you need to see even more patients to profit. These are residencies that I really liked, and the only reason that I chose one above the other were for very insignificant small details. Now for the last two on my list, which one is it going to be? Surgery or psychiatry? Drum roll please. So second on my list is psychiatry. Now psychiatry will always have my heart. I don't know why, I can't really explain this part, but during my first and second year, my favorite topics, lessons, days were when we were going over psychiatry. I don't know what it is, but learning about how people work, why they do the things they do, different personalities, all of that is just so interesting to me. I also feel like I'm a very empathetic person who loves to hear about other people's days. Just in my day-to-day life, I'm always the one to love to hear people talk instead of wanting to talk, and I love to hear what bothers other people, hear what their insecurities are, and I feel like that natural personality of mine really lends to a career in psychiatry. During my rotation, we would sit down and I would ask patients how they were doing. They would talk to me, and just having them talk to me and being in any way therapeutic as I can be was so amazing. I wish we got to do a little bit more of therapy in which I talked to them through their issues, through their problems. But one thing that kind of made me hesitant about a career in psychiatry was that it's a lot of pharmacology. Psychologists and social workers are the ones who really talk to patients and give them the cognitive behavioral therapy, psychotherapy, the things that I find really interesting. They are the ones who do it more often, and psychiatrists are more the ones who kind of manage medications. Because I love the field so much, and I would love to do psychotherapy more than the pharmacology, but that's just not the way that things are going right now. If you want to make money as a psychiatrist, it really isn't in giving patients hour-long therapy and making $50, $100 on that. It's about managing medications in 30 minutes. Now, as a psychiatrist, you can do therapy and you can have your own business, which is something that's really important to me. I really want to have my own business someday. I can't really say any more bad things about psychiatry because I loved it so much. I did. I really saw a career for it. You can have your own business. You take care of patients just through talking to them, and you can make an immediate impact, and you get really good at pharmacology. There's just so many things that I love about the field. And so there's not that many bad things about it. It's just that number one is just more perfect for me. So number one obviously is surgery. And this is probably not a big surprise to a lot of you because I've talked about it a lot, but it's just the one that I fought to not love. I really did not want to love surgery because surgical specialties are the most competitive. Surgical specialties often have the longest hours and the longest training. Like, of course it would happen that my favorite residency would be the one that's one of the hardest to get into and one of the hardest residencies in general. I really wanted to like something else because during my first and second year, I shadowed surgery and I knew I loved it. I knew that it made me so excited and happy to be able to use my hands and make an immediate impact right then and there. But I didn't want to love it. I needed to love something else because the training is so hard and the hours were so long, so I fought to love psychiatry. I was going to pursue psychiatry. I fought to love family medicine. I wanted to love other things, but when I got to my surgery rotation, it just became an undeniable truth that this was the one that I loved the most. I knew in my soul that if I was in any other residency that I would always miss the OR. I would always miss being that surgeon that comes up to you when you're in the pre-op area and being like, look, it's me who's going to literally change your life right now. You have a gallbladder that's infected, I'm gonna be that one that takes it out. You got shot in the arm, I'm gonna be the one who covers it with a skin graft. You have liver failure, I'm gonna be the one to give you a liver transplant. I'm gonna be the one to save your life, and it's going to happen because of my eyes and my hands. I have fantastic vision. I have like 20/15 vision, and growing up I loved playing video games, I loved doing my makeup, I loved doing my hair, I loved using my hands to do everything. Surgery was just everything that I loved all in one. Obviously it is a residency that's maxed out in procedures. That immediate impact is there, and there's also a bit of patient interaction. Now, I'm not at all sure about what surgical specialty I would like to join, but there are a few I have in mind. I'm probably just going to go for a general surgery residency so that I can keep my options open. There are some things that you can't really explain. I don't really know why certain things agree with me more so than others. Now, in surgery, there is a huge learning curve. Surgery is so different than the rest, and so when you're in your surgery rotation, you have to learn how to scrub in, how to gown, and even just doing that is really difficult because there's so many little intricacies of things that you need to do to make sure you don't ruin the sterile field. Just even learning how to not ruin the sterile field is a huge learning curve. It takes a huge learning curve that I don't think a lot of people allow themselves to give general surgery. A lot of people get really fed up and annoyed by all the rules and regulations in the OR. But if you just get over that initial part and you finally get to be there and you know how to follow the rules, and now it's just time to cut, that's where the magic is. The whole learning curve, I feel like, wipes so many medical students out of general surgery. But once you get there, I just feel like that's where the magic is, and I just feel like that's where I am. That's where I want to be. Thank you guys so much for watching this video. Now it's time for the giveaway. Now you made it all the way to the end of the video. I think it's time for a prize. Now, during my third year rotation, I used three main resources. I used case files for family medicine, pediatrics, and OB/GYN. And for the rest of my rotations, I used online med ed and UWorld. Using those three resources, I was able to score almost above 90 percentile for all of my NBMEs. And I got a B in pediatrics, but other than that, I got scored all A's in the rest of my rotations. Now, what is the point of having this YouTube channel if I'm not able to give back to you guys? And so one of my lucky subscribers will be able to win the Online Med Ed Whiteboards book. This just came out last month. It retails for $100. And it's really expensive, but honestly, I absolutely love this book, and I absolutely love Online Med Ed so much. I'm not being paid to say that. I've been saying that before they even knew who I was. Their videos are absolutely amazing, and I attribute a lot of my success in third year, almost all of my success, to them and UWorld. They have almost 250 videos covering all sorts of topics in third year, and if you watch them, take notes, you will go so far on your shelf exams and for step 2. I wish I had this book a year ago while I was watching all of their videos. It just came out a month ago, and I've already written some notes in it. I'm giving this away to one lucky subscriber who really needs it so that they can have it when they need it and not last minute like me. All you have to do is be subscribed, follow me and Online Med Ed on Instagram, and leave a comment down below about why you should receive this book. Thank you guys so much for watching this video. Thank you guys so much for all of you for following me along in this journey and coming with me to this point where I realized that I do want to grow up and I want to be a surgeon someday. I'm the first human medical doctor / surgeon in my family. I don't know anybody who does this, and so this is all brand new. This is interesting and a little bit scary to me, but I feel like I can do it, and I have a lot of this confidence because of you guys. So thank you guys so much for being there with me and just being the best fans that any YouTuber could ever want. Thank you guys so much, and I will see you in my next video. Goodbye, everybody.